A 55-year-old male presents with tremor, rigidity, and bradykinesia. MRI reveals atrophy in the part of brain associated with motor control. Which of the following structure is not involved in the region? So they have given the option caudate nucleus, putamen, Substantia nigra, and the red nucleus. Okay, and the red nucleus. Now you know this triad: tremor, rigidity, bradykinesia. This triad is seen in your Parkinson's disease. Okay, Parkinson's disease, which involve the basal ganglia. Okay, involving the basal ganglia. It's a neurodegenerative disorder involving the loss of dopamine from the Substantia nigra. So from this, just the three triad, that is three signs and symptoms: tremor, rigidity, bradykinesia. You know, it's a Parkinson's disease and it is involving basal ganglia. Now you have to know the components of basal ganglia. So let us come to the components of basal ganglia and then we'll come back to this question. Okay, now what is basal ganglia? These basal ganglia are very large subcortical masses of gray matter. Okay, subcortical masses of gray matter, and they include your caudate nucleus. Okay, then you have the lentiform nucleus, which involves the putamen and the globus pallidus. You also have the amygdaloid nuclear complex and the rostrum. As you can see in this image, okay, this is the head of the caudate nucleus. Head of the caudate nucleus, you can see the thalamus down here, and now this entire nucleus is the lentiform nucleus. Okay, now this lentiform nucleus is divided into putamen and globus pallidus. Again, globus pallidus is divided into globus pallidus interna and externa. Then you can see this outside gray structure, that is the rostrum. Okay, so these are the components of your basal ganglia. Now, as you can see, we have already discussed the components of basal ganglia. Now, in a cross sections, if you want to see, then you can see this is the thalamus. Okay, you have the head of the caudate nucleus. You also have the lentiform nucleus, the subthalamic nuclei below, and this is the rostrum. This is the cut section where we have to identify the nucleus. Now, let us come to the normal pathways. Okay, what are the direct and indirect pathway for controlling the movement? Okay, this is a diagram I have drawn, a very simplified version to make you understand the pathway. Now you know that if I want to walk, okay, if I want a movement, then my motor cortex will send a signal to the corpus striatum. That is, striatum is involvement of your caudate and the putamen. Okay, so caudate and putamen involves the together it is known as your corpus striatum. So I have sent signal to the striatum. From the striatum, okay, the signal will go to the globus pallidus interna. Okay, globus pallidus interna, and from there again this signal will go to the thalamus, and from thalamus the signal will say that okay, you can move the limbs or you can walk. Okay, so it is a positive feedback pathway. Feedback pathway, and it is a direct pathway that you are getting signal from the motor cortex. The signal is sent to the corpus striatum. From striatum it goes to the globus pallidus interna to thalamus, and thalamus is again giving signal to the motor cortex. Okay, you can move the limb, you can walk. This is a direct part. Now what about the indirect pathway? Now indirect pathway, what happens? The motor cortex again sends signal to the corpus striatum. Now from the corpus striatum, the signal goes to the globus pallidus externa, not interna but externa, and from externa the signal will go to the subthalamic nuclei. Okay, now what this subthalamic nucleus does, that it sends negative signal to the globus pallidus interna, and from the globus pallidus interna the signal goes to the thalamus. The signal goes to the thalamus, and from thalamus the motor cortex, the signal goes to the motor cortex. And in this pathway it is saying that the movement should not occur because it is a negative feedback pathway. Okay, the movement should not occur because it is sending the negative feedback from subthalamic nuclei, the negative feedback. Now what happens, from the Substantia nigra it releases the dopamine, okay, neurotransmitter dopamine, and it sends positive signal to the direct pathway. And if it is sending positive signal to the direct pathway, then the movement, normal movement is occurring, because in the direct pathway anyways the it's a positive feedback, so the signals and which is sent to the motor cortex is your positive, and so the direct normal movement is occurring. But what happens in the indirect pathway, the indirect pathway is already giving negative feedback, so it is saying to stop the movement. So for the initiation of the movement, what the dopamine has to do, the dopamine will again send signal to this initial signal coming from the motor cortex, but the dopamine will give the negative signal. Now you know that here we already have negative and dopamine is again sending negative, so negative is positive, so ultimately the movement will occur. Okay, so direct pathway is saying that normal movement is occurring, I want to walk, so normal, I want to move my legs, so you are getting signal from the motor cortex. From the motor cortex it is going to the corpus striatum, from the striatum to the globus pallidus interna, and interna is sending again positive signal to the thalamus. Thalamus is again sending excitatory or positive signal to the motor cortex, and then the movement is occurring. That is direct pathway. Indirect pathway, what happens? Signal coming from the motor cortex entering the striatum. Striatum is sending signal to the externus. Externus is sending signal to the subthalamic nuclei, and this subthalamic nuclei is giving a negative feedback, negative signal to the thalamus, and from thalamus again you are getting the negative feedback to the motor cortex. So indirect pathway is saying you have to stop, you can't move, right? Now if you want to initiate a movement, dopamine should act positive in the direct pathway and negative in the indirect pathway, so both the negative forms are positive, leading to the movement. Now what happens in Parkinson's disease? What happens to dopamine? There is loss of dopamine. Okay, so if there is loss of dopamine, this pathway is gone. The direct pathway means movement will slow down, and this pathway is also gone. So it is saying to not move the limbs, so there will be rigidity. Okay, both and since direct pathway is saying you have to move the limb, and indirect pathway is saying do not move the limb, without dopamine, move and do not, move and do not, this will lead to tremors. Okay, this will lead to resting tremors as well. So you have slow movement, you have rigidity, okay, and you have your tremors. This involves your Parkinsonism. So I think you have understood the pathway. So this is the schematic diagram. Again I have shown this is a normal pathway which is occurring. Okay, and now what happens in Parkinson's disease? This dopamine is gone, so what will happen? You can't move the leg, slow movement, and then in the negative feedback, negative pathway, indirect pathway also dopamine gone, so again the movement will be gone, slow movement, there will be tremors, and there will be rigidity and bradykinesia. Okay, so these are the symptoms of the Parkinsonism, and this is the direct and indirect pathway involving the basal ganglia. So coming back to this question, they have asked which of the following is not involved. So you know that the components of basal ganglia, yes, caudate nucleus is a component, putamen is the component, Substantia, nigra again the component. So the answer here will be red nucleus. Okay, red nucleus is present in the midbrain and it is for your motor coordination also, but it is present in the midbrain. Okay, midbrain structure. Okay, midbrain. So the correct answer to this is your red nucleus. Even without thinking about the pathways, you know that the components of basal ganglia, what are caudate nucleus, you have the lentiform nucleus, and then you have the claustrum. So you know the components. If you know the components, then you can attempt this question easily. Okay. So that is about the basal ganglia and the pathways. So we are coming from the cortex to the basal ganglia, just from outside to inside in a systemic way. Okay.
To watch the full video, download our app on App Store and Play Store.